the implementation of a conflict management measure in a psychiatric health organization in the Netherlands had a positive influence on safety culture. So we're going to define safety culture later. So in other words, we were going to look at whether it was implemented effectively, and also if the implementation had an effect, a positive effect on patient safety. So first of all, safety culture. This was defined as the product of an organization's health and safety management. So it was found that every psychiatric health organization has a organizational culture which contains shared values, norms, rituals, patterns of behaviors with regards to patients and staff safety. So this safety culture can be assessed by the Compass, which in Dutch is de cultuuronderzoek onder medewerkers over de patiëntveiligheid in ziekenhuizen in Nederland. But this was based on an American survey, actually the hospital survey on patient safety, HSOPS for short. And this included 11 dimensions, including communication within and between wards in a psychiatric care organization, as well as actions promoting staff and clients' safety, and of course also the overall perception of safety within the organization. So this questionnaire, because that was it was a self-reported questionnaire, and this was conducted previous to the research I'm presenting today by the staff of a particular healthcare organization, Emergis in Zeeland, and the results of this questionnaire provides a background to which the effectiveness of the response method can be interpreted. So moving on to the response method. I'll call it response method from now on, and I've been calling it response method, but the full name is Response Crisis Intervention Model for Conflict, and it was founded by Alexandria Wickler in the US. And the philosophy behind it is basically that a crisis situation is an opportunity for learning proactive conflict management skills. So every crisis situation gives you the chance to gain knowledge, actually, and how it can be prevented the next time, and how we can work with it. And the main aim, basically, is to design an organizational and cultural norm for safety and nonviolence within in this particular case, within a psychiatric healthcare organization. And the method is basically based on self-assessment as well for the individual practitioner, as for the team, as for the clients themselves as well, so they can reflect and evaluate an incident, for instance. And this method was implemented within Emergis, the organization in question, in 2008, because they were looking for a method of conflict management that had less hands-on intervention measures, basically, and because they strived for a conflict management method that had reduced rates of seclusion. So basically, they wanted those things, maybe the more traditional or even, we dare call it, old-fashioned ways of handling conflicts. They wanted to go for a less intrusive and less invasive way that was founded more on communication and working with clients. Quite quickly, the method summary. This research was conducted in 5 inpatient wards at a mental health care organization in Zeeland. The instrument was a questionnaire as well as an interview. There was an interview component in the questionnaire itself. And the analysis was a qualitative one, and that is because even though the questionnaire that was designed was more invited us to do a quantitative analysis, however, when conducting the research in the field, it turned out that some clients had difficulty sticking to the questions, and they gave us a lot of information on the side that was beyond the scope of our questionnaire. However, we deemed that it was still important. And a really nice example of this is a woman that specified to me that she had been living in that facility since 1985, and that it had appeared to her that so much has changed in the past few years with regards to how conflicts were managed and how staff members responded to incidents of either verbal and or physical violence. So that is the reason why we went for qualitative analysis and not